I'm Laura, and I'll be doing my Teach 1 assignment on precision and predictive medicine for HAP 360. Precision medicine is an emerging approach for diseases, treatment, and prevention that takes into account individual variability in genes, environment, and lifestyle for every person. An example includes designing targeted treatments for different cancers and diseases. Predictive medicine is an approach that predicts the probability of disease and instituting preventative measures in order to either prevent a disease altogether or to significantly decrease its impact on the patient. Some examples include carrier testing, prenatal testing, and preconception testing. So the objective for this assignment is to use data to find whether or not the tested drug is effective, and then also to identify which medication has the highest success rate when a person has an anxiety diagnosis and when a patient has a substance abuse. So question 1 first asks to create a table showing the relationship between anxiety diagnosis and citalopram. So what you would do is you go to your data, go to Insert, Pivot Table. The data's already been pre-selected, so you just hit OK. And then you type in generalized anxiety diagnosis, put that in the rows. And then citalopram is CIT. So CIT success, go to columns, and it'll also go to values, and then you go to your value field settings and change the sum to count because you want the count. And there's your table. And after that, you calculate the rate of success, which is the number of success, which is 117, and you divide that by the grand total, which is 366, to give you 0.319. And that's basically what I just did. And so you just calculate the rate of success by dividing 117 by 366. 366 is going to answer 0.32. Now question 2 asks you to calculate the success rates for all of the different drugs. So basically you would do what I just did for citalopram for the remaining 6 drugs to get these answers. And as you can see, citalopram or CIT had the highest success rate of 0.32 or 32%. Now the second part of question 2 asks, why is it difficult to understand which medication works for patients with generalized anxiety depression? This is because every patient is different and every person reacts differently to each medication. So while one patient may react well to one medication, another one may react very badly to that same medication. Now question 3 asks, which medication has the highest success rate when the patient has a substance abuse? So again, you would go back to the same data, and you would go to Insert, Pivot Table, again, OK, because all the data has been selected, and this time you would type in drug abuse diagnosis, put it in your rows section, and for this one I'll do citalopram again, and you do columns and values, and again change the value field settings from sum to count, and then again to calculate the rate of success you would do the number of success patients, which is 36, divided by the grand total, which is 115, to get you 0.313. And after calculating the rate of success for all of the remaining drugs, you should get these following answers. And as you can see, out of all the drugs, BUP had the highest success rate of 37.5% out of all the drugs. And this brings me to the end of my Teach 1 assignment.